In fact, there is no single model that can accurately reproduce the authentic pathogenesis of any specific S. pyogenes disease, end quote. And that is their statement, not mine. Is strep the great concern like we're told? Can it spread to the heart? And should we be cautious and take those antibiotics that were prescribed for strep throat, or if our kids have strep throat, to avoid the scary rheumatic fever? This video series is going to extensively cover strep, the collection of symptoms we call strep and blame on strep. I get so many questions about how to naturally cure strep, but it's crystal clear to me that throwing a few options out there at people is not even remotely enough, because this is our understanding of the body. The understanding of microbes is completely misguided. We must investigate this thoroughly. So we're going to cover in part 1, why do we believe strep causes illness? The scientific paper trail that I've done. Part 2, how to cure strep without antibiotics. Part 3, but can't it spread to the heart? Part 4, ASO titers and rheumatic heart disease. And part 5, we're going to cover how to actually support healing through this type of symptom list. Okay, first up, why do we believe strep causes illness? Here's the science. So why do we believe bacteria cause disease at all? In this case, why do we believe strep causes disease? And why do we believe it spreads to the heart? We've been told since we can remember that this is true. We've seen people get sick. We've seen people with these types of symptoms, including our kids. We see a symptomatic person, and the narrative for why they become sick was already written and spoken into our minds long time ago. We assume that there is science to back up this narrative. After all, we can Google cause of strep throat, type that in, and have a slew of PubMed articles pop up for us. You can see the first few hits on Google, an article stating, quote, Streptococcus pyogenes, often called Group A strep, is a major human-specific bacterial pathogen that causes a wide array of manifestations ranging from mild, localized infections to life-threatening, invasive infections. Ineffective treatment of S. pyogenes can result in the post-infectious sequelae, like acute rheumatic fever, and on and on and on. You see these all over the internet, all in PubMed, on the top page of Google. So we believe this alone is enough to settle our mind. If we can find hundreds of articles with that very statement, it must be true, right? Unfortunately, most people don't understand the fundamentals of the scientific process, and that finding bacteria anywhere on the body is not proof of some infectious transmission, nor is it proof that it caused the very thing that you think it did. That would require proper transmission and isolation studies. You'll see that with strep, and actually all bacteria, they have never provided evidence that bacteria from a person can be transmitted to another person to cause illness. Okay, that's the important part. Instead, they tinker around with other research efforts to try to fill in the vast holes that remain, sequencing genomes, playing around with antibodies, and growing bacteria in cultures. None of which confirms transmission, none of which confirms infectiousness of bacteria. When one wants to track down the original studies that supposedly proved the causative agent of a named infectious disease, it's like trying to find a ghost. Try it and you'll see what I mean. Most people don't have the time or take the time to do what I'm talking about. There is literally no legitimate papers demonstrating that bacteria are the cause of any disease whatsoever. They state this over and over actually, but with no backing. The ghost shows up as references in these research articles, but somehow cannot be identified when traced back to the very articles they originally cite. The original ghost cannot be found nor validated. However, the studies continue to build on this ghost, this general assumption, an invalidated hypothesis, yet our entire medical system is built upon it. Let me show you what I mean. In a systematic review and meta-analysis in 2021, they make the claim that this review's process is to, quote, provide robust contemporary evidence for the modes involved in strep A transmission, end quote. Now, to provide evidence in transmission, you'd have to first prove that it is indeed a transmissible disease by isolating the suspected variable and causing disease with that isolated variable. They do not do that ever. They go on to claim, Quote, Strep A causes superficial infections, invasive infections, cellulitis, skeletal infections, sepsis, necrotizing fasciitis, and toxic shock syndrome, and post-infectious immune-mediated sequelae, rheumatic heart disease, glomerulonephritis, end quote. They do not provide any scientific resources to back up that statement. They just make the statement. To claim cause, we need to have confirmation of that cause. Now, mind you, this type of scientific article, a systematic review, a meta-analysis, is one that scans the entire body of literature. This is not cherry picking here. And it provides a summary of what those findings are over time, over the entire history of the known disease. Systematic reviews are considered the most reliable resources, and they are the most sought after information for questions about health. That's not my opinion, that's just what they say. I'm just telling you what they themselves say. So let's see if we can track down any sound proof that strep causes disease, since they continue to repeat that in these reviews. They write in this review, quote, traditionally, transmission of strep A has been primarily attributed to large respiratory droplets, based on studies that use one of two methods. So check this out. Method 1, evaluating the saliva of patients who had sore throats or scarlet fever. And 2, the second method is environmental epidemiology, which involves measuring the quantity of strep discharged into the air in a controlled room through coughing, sneezing, and talking. End quote. Okay, so did you catch what they said there? The way these studies on bacteria are done, and you see this over and over again when you look, is by simply measuring, quantifying the presence and number of bacteria in a person or fluids. That's it. That's no different than evaluating the number of firefighters at the scene of a fire. There's 15 firefighters there. You know, they call it evaluating the environmental epidemiology. It's no different than evaluating the number of white blood cells at the site of an injury. There's 10,000 white blood cells there. Or the number of antibodies a person has. There's 200 of those types of antibodies. As you can see, none of these provide any evidence of what caused the increased number of firefighters or white blood cells or antibodies. This is the most critical thing to understand that so many people just do not understand. It's a direct nod to the phrase you've likely heard before. Correlation does not equal causation. They always like to throw that at us when we're talking about, things that start with a V. Now, this means just because something is associated with something doesn't mean it caused it, and that's valid. But more specifically in this case, what I'm talking about is just because bacteria can be counted in a fluid doesn't mean it's the cause of the said issue. That would need to be tested for and controlled for. Next, see all those numbers cited after the sentence? Quote, traditionally transmission of strep A has been attributed to large respiratory droplets. You see all those numbers after that statement? This is the place you'd expect to find some scientific backing for how they've come to understand that statement. That strep A is indeed a contagious and transmissible disease between people. Now, when you read each cited study, the original studies that supposedly proved this, they literally never do that. This is the case every time, not some of the time, every time. Now let me show you, because this is where it really goes off the rails. Most people simply trust that sentence without even cross-referencing it, except people like me and some of the people that I work with and some of my friends. Let's look at that first citation, number 13. This is from a study from the University of Chicago on Army personnel in 1944. This is what they studied. Quote, these studies revealed that nasal carriers frequently discharge hundreds of millions of hemolytic strep into handkerchiefs when blowing their noses. Okay? Sneezing expelled far fewer. The output of single sneezes of throat carriers ranged from none to so-and-so, and nasal carriers from none to so-and-so. Most coughs were entirely free of these bacteria, although rare coughs dispersed, and they count how many. End quote. That's it. They simply measured how many bacteria are present in fluids. No study of actual cause or transmission of disease whatsoever. Next citation, maybe they'll do it in this one. Number 14, let's take a look. This is a 1905 study from the Memorial Institute for Infectious Disease. And this is what they studied. Quote, streptococci are expelled from the mouth in invisible droplets of sputum by coughing, speaking, whispering, crying, or breathing forcibly through the mouth. They are expelled at a distance of at least 36 centimeters. Now check this out. 33 out of 50 scarlet fever patients, most of them children, were found to expel strep in coughing, crying, or breathing. 42 out of 50 normal adults were found to expel strep in coughing or in speaking. End quote. Again, we see a simple counting of bacteria and fluids. That does not demonstrate any causation or transmission. Furthermore, did you catch the last sentence there? 42 out of 50 normal asymptomatic people expelled strep in coughing and speaking. Now, isn't that interesting? Normal asymptomatic people also have the same bacteria in their fluids. Now, they acknowledge in the study that, of course, to prove causation, they would need to replicate the condition after isolating the bacterium and inoculating it on a healthy host and then replicating the symptoms, right? That's science, scientific process, and that's logic. But this is what they wrote. Quote, it has already been stated that animal experiments are unsatisfactory so far as the determination of the virulence of an organism is concerned. Nevertheless, as a matter of curiosity, 7 of the organisms isolated from these cases were injected into as many guinea pigs in the dose of 1% of their body weight. For as the guinea pig is, this is their claim, not very susceptible to strep, so a relatively large dose must be used. 4 of the 7 strains thus tested proved pathogenic. The animals died after 1 to 3 days, and the strep being recovered from the peritoneal cavity and organs. End quote. So in other words, animal models are not satisfactory to prove this causation because they can't reasonably replicate the condition even when they do illogical things to try to. They give the poor lab animals incredibly large doses of the cocktail injection, 1% of their body weight, straight into the abdomen, not via any natural course of transmission, which would be expected. After all, the whole study is based on respiratory droplets as the source of believed transmission, yet they always revert to injection into the animals in these studies. Why? Well, this is because it is indeed one way to kill the animal after pumping them with a large cocktail, a large dose, according to their own words, of undisclosed ingredients straight into the abdomen. Here is a photo of a lab animal getting injected in the same manner lab animals do to prove these types of hypotheses. They take a soup of stuff, without informing us what the actual soup is, and then inject it into large amounts into the abdomen. When animals die, they claim it was due to the bacteria. No controls done. Ladies and gentlemen, that is their best proof that germs cause disease. If you're not suspicious, I don't know what will make you. This not only fails common sense, but it also fails their own set of rules, their own guidelines of the scientific method. Moving on, citation 15 and 16 are other studies done in 1944 by the same author in previous citations. Again, measuring quantities of bacteria in saliva. The methods were the same as before. Citation 17. This was a 1971 study. They measured viable counts of beta hemolytic strep per milliliter of saliva in children. Again, they measured bacteria. That's all. Citation 18, a 2006 Australian droplet study. They studied droplets and theoretical modes of transmission in the air and in humidity. Again, no isolated transmission studies. Let's take a look at Table 1. The number of droplets generated during human expiratory activities such as coughing, breathing, talking, and laughing. No transmission studies, they simply measure how many respiratory droplets formed with different activities. Moving on, citation 19 is a 1947 study looking at sailors in training in Illinois. They studied how many strep bacteria might be transferred to the hands when a nasal carrier strep shook hands with a so-called asymptomatic person. Now what they found, quote, review of the tables reveals no direct quantitative correlation between the actual number of strep expelled from the nose and those recovered on the hands of an individual carrier, nor between the number on the hands of the donor and the recipient. And check out what they said here, it had me laughing pretty hard. Quote, "It may or may not be a coincidence that the recipient whose hands were most heavily contaminated during the test was an extremely attractive young woman," end quote. They said it, not me. That was part of their study. But again, you see, it's just more studies of how many bacteria can we find? How many can we count? Can we count them here? Can we count them there? Are they on the hands? Are they in the nose? Let's count them. There's no proof of causation of disease, no viable isolation of variables, and proof of causation of illness. I can find billions of bacteria on a dead animal in the road. That doesn't mean the bacteria killed it, as any logical person would understand. Now, citation 20 was another 1947 study done by the same author, cited several times here. This full article can't be viewed, or at least I couldn't find it, the full article, but the first page I found, and it indicates and says that this study was looking at why it's so hard to lock down why some carriers don't get sick, nor seem to get others sick. They came to the conclusion that for transmission to occur, the patient had to have very, very high levels of strep in the nose and throat. But here again, we are merely counting bacteria and making claims based on the number of bacteria we find. Now, I'm going to stop there with the more in-depth analysis on going through each and every citation, but I think this is important to cover in detail how one must cross-reference these studies. This is what I do all the time, as this is the foundation. This is why we believe that bacteria causes clinical disease. We believe it because we see just snippets of these studies and we think they're legitimate until we really dig into them. Keep in mind, again, this was a 2021 systematic review and meta-analysis with the most pertinent studies that demonstrate strep bacteria is the causative agent of disease, according to them. They used all the best evidence that they could possibly find. Yet all the citations they linked up showed no such thing at all. Reading a research paper must go beyond just reading the title or the introduction or conclusion. When bold statements are made, often in the title, there needs to be logical scientific backing that adheres to some kind of logical methodology to such claims. When it's not, it's just this ghost chase, okay? The proof of causation just isn't there. Now, the other citations referencing causation, citations 21 through 38 and onward, I personally checked all of them myself. It is all the same smoke show, and you can go ahead and check them yourself as well. They again measure the quantity of strep in the nasal passage, in the air, in the dust, in the bedding, in food, recovering strep topically on skin, counting the numbers of organisms in normal people and the so-called carriers. They merely are counting and using calculators. They quantify, they count, they never demonstrate or provide evidence that it is indeed the cause of any transmissible disease. Now, I know this is difficult for people to grasp because the narrative runs so deep in our psyche and it gets confirmed again and again every time we see someone get sick. We see people exhibit similar symptoms and we can't even fathom that there might be other reasons and factors that would allow for that outside of this germ model we've been led to believe. Instead, they repeatedly revert back to this unproven ideal that must be a germ. It must be a microscopic particle that is caught and then causes disease among people. Don't just take my word for it though. This is what the scientists that study strep say themselves. Quote, "However, for S. pyogenes, the development of in vivo models, meaning within a living organism, has proven to be challenging for a number of reasons." Quote, "It's important to note that there is no single comprehensive model of S. pyogenes infection. In fact, there is no single model that can accurately reproduce the authentic pathogenesis of any S. pyogenes disease," end quote. Let me read that again. In fact, there is no single model that can accurately reproduce the authentic pathogenesis of any specific S. pyogenes disease, end quote. Reproduction is key in science, and that is their statement, not mine. So you'll catch these admissions when you read the papers closely. In other words, they have no idea on the origination and development of the very disease that they continue to insist is caused by a microbe. How could this be the case? How can so many people be taught such wrong information? Literally billions of people believe this is true. Well, it's the same way we so strongly believe whatever we're taught, and that is authoritative repetition and appeals to authority. We believe what the so-called experts say. We believe what the textbook tells us, and more currently, we trust what Google informs us or what we hear on social media. That's how it's done, and it's how it's always been done. It's convention, it's consensus, which by the way, is actually not science. It's merely an accepted model, an accepted understanding. It takes a real long time for that to change, even when it's dead wrong. This convention and industry consensus is why we continue to give treatments that have been shown to be ineffective and even harmful. For example, it's this very convention that continues to give people highly invasive surgeries when top-level research shows it's completely ineffective. Here's one example. Why are we still doing open heart surgery when the most current research tells us these bypass surgeries are not effective? 500,000 bypass surgeries are performed each year in the US alone. Nearly 1 million cardiac surgeries performed in the US. I'm sure you know several people who have gotten one or another. Yet did you know this? Multiple studies have shown they do not lower the risk of heart attacks or death. Shocking? It's the truth. They do not lower the risk for future heart attacks or death. Why do I bring this up? Why does it matter? Because if we are cutting chests open for no reason at all, do you think the industry is going to slow down and take a gander at the main foundational pillars of the entire medical establishment? In this case, the inaccurate premise of germ theory? If doctors continue to do risky invasive procedures, ones that are not effective simply because they were taught to and it's consensus, why would we expect them to put a magnifying glass on literally anything else? They won't. This is where logical scientific thinking has to come in. We must scrutinize, we must question and push. We must look at the research ourselves and try to connect the dots because no one's going to do it for us. When you do that, you see gaping holes without any dots at all. They just fill it in anyway. They will take decades to even catch up to the latest research in their own model, in their very own model as they do. Unfortunately, it'll be too late for many. You know, this is our life. These are our bodies. So we have to become investigators towards what makes sense and what actually has any legitimate backing to it. And most importantly, if this is the state of what they call healthcare and so-called evidence-based healthcare, how do we trust them at all? To think that your uncle, your dad, your mother, your partner went under the knife for a major surgery when it was not only unnecessary, but it didn't actually help resolve the issue or prevent further issues from occurring. And now they know it and they still are doing these things. They still recommend these things. When addressing Caltech grads about good science, Richard Feynman said this: the first principle is that you must not fool yourself, and you are the easiest person to fool. So you have to be very careful about that. After you've not fooled yourself, it's easy not to fool other scientists. You just have to be honest in a conventional way after that. I'm talking about a specific extra type of integrity that is not lying, but bending over backwards to show how you're maybe wrong, that you ought to do when acting as a scientist. And this is our responsibility as scientists, certainly to other scientists, and I think to laymen, end quote. That's what he said. Science must intentionally try to prove itself wrong, as he said. It must look for the holes and test those holes. That's the whole process. So that brings me back to strep and to this notion that germs are the causative agent of disease because scientists simply count them on bodies and in fluids. Strep is everywhere. It is found in completely healthy and asymptomatic adults and children. This should come as no surprise considering we are more bacteria than we really are even human, so I'm told. The microbe is not the issue, it never was. It was a response to something, just like firefighters are a response to an issue, and counting them certainly isn't going to tell us what that issue is. Like white blood cells are a response, antibodies are a response, cholesterol plaquing is a response. These are not the cause of problems. These are adaptive responses to problems. That is a difference that one should understand if healing is the goal.